Now, hold on there, bud.
We need X-ray to see.
You're not touching my hat. It's my lucky hat.
Right now, let's worry about your head.
Man versus antler, queen and her throne, and what in the vampire is happening here? Today, we are breaking down some of the most bizarre medical scenes and unexpected injuries from the untold stories of the ER. All right, let's dive right in.
The president of the frat, he shot this deer, and it's like his prized kill. He'll murder me if it gets damaged.
He's in seat collar precautions, which is good to protect his neck. I'm assuming they did imaging to see where the antlers are to make sure they're not like inside his skull.
Can't you
What
get
the
it off
heck?
without cutting it?
Unfortunately not. Gotta get the bolt cutters, we snip it off, we go ahead and numb up the area and pull those out, a couple loose stitches, and you're good for your hot date tonight.
You kind of have to use any equipment that you have available, different tools. Sometimes you have to contact the police department, the fire department to see what kind of tools you have to be able to break these off, cut them off. You can still use like a saw, but that would be kind of a lot of mess because of the debris.
All right, you guys stable, got this? All right.
Okay.
It's all right, it's all right. And it makes a horrible sound. Okay.
So antlers are bones, and that's why he made a crunching noise through the bone. So then you see that he still has some attachments of the bone to the top of his skull, and that's where the doctor can anesthetize the area and then work to get those pieces out.
Now let's get the head off.
Oh, boy.
All right. And she's all yours.
If the antler is in the bone of the skull, then there's a concern that an infection could ensue of osteomyelitis, and this is when you start getting discussions with the specialist of, do we take this individual to the operating room to wash out the wounds really well? Do you just wash them out really well here in the emergency department? Really close follow-up, antibiotic therapy potentially because of such a high risk close to the, the brain and the skull.
It's Dr. Zoll.
Doc, I've got a patient here, a middle-aged woman. She's stuck in a toilet.
She's what?
Your call, we can do it. Do you have a wrench in the house?
Why?
Well, we're gonna have to take her to the hospital with the toilet.
I guess this does really happen. I can imagine if the toilet seat is up and you fall in, you get stuck and different pressures are related to it. I wonder why.
This is Nancy. She's been stuck in there for nearly 18 hours.
Oh my gosh, 18 hours? No wonder why she doesn't feel good. The things that I immediately think about is like ischemic tissue, dead tissue, kidney failure now, dehydration.
I can't feel my legs.
She
Yeah.
looked dehydrated, but in terms of dry mucous membranes, her eyes looked a little sunken.
For hydration status, we document something called mucous membranes if they're moist or dry. And the mucous membranes meaning like your tongue, your cheeks, your lips. Now they put her on oxygen most likely, not necessarily that she needs the oxygen, but it's more supportive, especially in somebody in this situation. EMS will do that.
My big concern when she arrived was the development of a blood clot in her legs.
Ah, interesting. So that's good too. How do you prevent that if you're in this situation? Continue to move your feet and like flex your muscles of the legs.
Breaking the toilet was the only good option.
3, 2, 1.
A lot of you will ask the question, why don't you just do that at the house? It's because of the potential of the complication that could occur if you break it and there was something massively wrong underneath that you didn't know, that you didn't anticipate. And on scene, you do not have the tools, the skills, then you're in a lot of trouble in the sense of something bad can happen to the patient.
So what is that?
Whoa.
That's a boat cleat.
Part of a boat cleat.
Part of a
in my
boat.
brain.
Well, we're going to need an IV, antibiotics, tetanus shot, X-ray, and get Dr. O'Neill, the neurosurgeon, and get him in here real quickly.
Okay, pretty good. Antibiotics, open wound, dirty instrument, need to prevent infection. Tetanus shot, just to make sure that it's up to date. IV, so you have access to give all these medications. The tetanus shot is IM, but the antibiotics will probably be given IV plus some fluids.
This leg up in the air for me, if you would. Tell me what day of the week this is.
Tuesday.
A neuro exam, we have a very basic one, whether it's a pretty extensive one. So he's doing an in-depth neuro exam, which is good, and everything seems to be intact.
We got to take that hat off in order to go over to X-ray.
Now, hold on there, bud.
We need X-ray to
gosh.
see.
You're not touching my hat. It's my lucky hat.
Right now, let's worry about your head.
Sometimes we do have patients where we need to remove the clothing, it's impeding in the way, and we have to cut it off, and we apologize, or we will do everything humanly possible to save the garment.
Cody, Johnny, is that you? What are you doing here?
Rustled a gator after I left.
Got a hook stuck in my leg.
No kidding.
When people boat, have fun, they drink. Alcohol is what they're discussing, and accidents do happen. So please be aware of that and make sure that there's no sharp objects around.
He's been getting really bad headaches and he can't sleep.
Right now, we see individual tired, weak. Could be a lot of different things. The differential diagnosis starts getting massive and huge. So you don't know the answer right away. So you need to start doing different types of blood tests on this individual and get more of the story.
Isaac's a skinny young man with multiple bruises all over him in different colors.
Majority of the time, somebody's medical issue is related to the events that led up to it and their symptoms that they're feeling, what makes it better, what makes it worse. Because this could be anything from like simple anemia, insomnia, malnutrition, headaches.
How did you get all these bruises?
Ever since this whole vampire thing started, he's been really into sucking. And
We notice a lot of petechiae, which are these fine pinpoint dots all over his skin.
Okay, sucking, so causing a lot of different bruising. So you think about like blood disorders and clotting issues, but then talking about petechiae. Petechiae is like those very small red dots that you'd see on the skin, and those are broken capillaries as well.
Have you lost any weight recently?
Like 15 pounds.
People lose weight on purpose when they're trying, but inappropriate weight loss, you think cancers, you think tuberculosis. Even if you're eating, you might have worms that are actually eating the food and you're not absorbing anything, you're not absorbing any nutrients because of it. So lots of different things, getting more information.
Dr. Marquardt and Nurse Sylvester have just discovered something unexpected in their asthma patient's rectum.
Typically when somebody comes in with asthma issues, it's related to their lungs. I don't know how they went from asthma to anus.
what are you gonna do about it?
First, we need to go in there and tell her what's going on, and then I'm going to call infectious disease as a consult.
Actually, the worms could be related to lung issues. There are some that can present as if it's an asthma exacerbation, but it's actually like a worm in the lungs.
What you're feeling down there in your rectum, it appears to be a parasitic worm.
A worm?
Yeah, don't be alarmed though.
A worm?
How do you help the individual in that circumstance? You literally need to tell them what's going on and trying to calm them down. Don't be alarmed. You're here at the hospital and we're going to take care of you, is what he's trying to say, but she's very alarmed.
We can't just pull it out. There's a lot of different type of worms, and depending on what type of worm you have, we're going to manage it differently. So
I might have tried to just see if it would hug out without pulling too hard, but yes, they could be latched on, they could be further up, it could be wrapped around a certain area, it could cause a perforation. So I get not quick movement to get it out of there. Definitely call a infectious disease specialist and see what they think. In honor of my new supplement line, Life Happens, launching, I'm going to give you all a special discount code called Don't Pull It Out 30. This will give you 30% off any of the health supplements I formulated. If you guys enjoyed this and want to see more Untold Stories in the emergency department, let me know in the comments. And as always, do me a favor, definitely check out this playlist right here, binge watch everything, and subscribe, turn on your bell notifications, and hit that like button for me so we can continue to grow this channel. Thank you so much for watching, and stay healthy, my friends.